Okay. All right. Seems like everything is going well. And just like you just saw, we are going to record this. We're going to put it on our YouTube channel as well, so that if you want to share it with somebody or you want to come back to information that we talked about, it is there for you to use as a resource. There's a lot of good information we're going to go over. So with that being said, let's go ahead and get started. Hello, everyone. Welcome. I am Dr. Nicole Gilliland. I work with Total Health Chiropractic. I work in our Tampines location. I've been there actually as of Thursday. That will be my 1-year anniversary. Woohoo. So what we're going to do today is we're going to talk about the benefits of movement for your body, what movement is, what good movement versus bad movement, how our body moves together from segmental movements and things like that to a global level, things like that, how we can assess if we're not moving well, what we can do to get moving better. All of those things are going to be covered and tied together like that, okay? Now, if you have any questions, we are going to have time at the end to answer any questions that you may have. You can type them into the chat while you think of them, or you can write them down. There are going to be parts that are going to be interactive, so we will be using the chat function a little bit, okay? So just so you know, if I do have the chat function on, so I will see your questions, but we'll come back to that at the end because it may be answered in another slide, okay? So to get started, I want you guys to know a little bit more about me. Let's see if and of course now my PowerPoint is not working. Oh, there we go. Okay, so I want you to know a little bit about me. Sorry about that. So like I said, my name is Nicole Gilliland. I'm a doctor of chiropractic. I was born in Alaska in the US. I was raised mostly in Wyoming, and then I lived in Atlanta, Georgia for 6 years before I moved to Singapore. That's actually where I did my Doctor of Chiropractic degree. So before that, I did get a Bachelor's of Science in Biology. So obviously sciences, especially biology, the study of life, that's what I'm passionate about. It's what I love. I've been a nerd my entire life, and I'm totally okay with that. And so why this subject, right? Why movement is so important to me personally is there's a lot of reasons. So I have been an athlete my entire life. I've been playing volleyball since I was 8 years old. It's one of the loves of my life. Obviously haven't been playing as much recently because of the restrictions and things like that. Because of that, because I have been in a couple of car accidents as well, I've had disc issues in my low back since I was 21 years old. So that's when I started to have excruciating low back pain. And through that, I found chiropractic. Chiropractic helped me get my low back pain in check. Also helped with the health of my spine, which we'll get into in a little while as well, how that works. And so I want to have the best quality of life as possible. I want to continue to play volleyball. I want to do my strength training, my spin classes. You can see some of my nieces and nephews that were at my graduation, my friends that I played volleyball with as well. I want to be able to do those things for as long as possible. And so in order to do that, we have to be able to move, and we have to be able to move well. So that is why this subject is really important to me. So moving on, who in here likes to move? And this is where we can use that chat function. So you can raise the hand in the chat. You can share the ways that you like to move your body. I just want you to think about for a second. How do you move? Do you enjoy movement? Okay, what movements do you enjoy? Okay, Matt likes to move. Hello, Matt. She was asking me on Saturday if I was ready for this. Nice to see that you're here. Okay, Matt likes to move. We all like to move.
Definitely.
Yes. Yes, it is a daily part of our life. Exactly. Okay. So that was going to be my first point away from that. Apparently, when I have the chat up, it doesn't like to be the PowerPoint. So we'll come back into that when we need it. All right. So a lot of you, when you first thought of movement and things like that, you may have thought about sports. You may have thought about athletics, things like that, right? All of these different things, right? That's what we're kind of socialized to think about, right? Is we need to be, these are the kind of movements that we think about. But like Alan was saying, movement is part of everyday life, whether you think about it or not, right? We need it to be able to brush our teeth, to cook our food, to play games with our family, to pack and shift our things, right? We need to be able to move. Okay. So I know initially that may have seemed like a really silly question, right? Whether or not we like to move. But have you ever thought about how lack of movement, whether that's voluntary because you just work so much, you're tired and you don't want to move, or involuntary, right? You're in pain, so movement is painful. So have you thought about how that affects your life? How that potentially affects you now? How that's going to affect you in 5, 10, 15 years? Okay. So what seemed like a silly question, it's really important, and we're going to dig deeper into that. So one of the things that we talk about at Total Health Chiropractic, and many other chiropractors will as well, is that movement is life, right? We need to move for the things that we do. Even within our bodies, things move. Okay. So better quality movement is going to help us with a better quality of life. It's also going to help us with optimal sports and athletic performance if that's something that you do as well. A lot of our patients are athletes, whether they're recreational athletes, just like to go for a run, things like that, whether they're professional athletes. We have coaches at some of the schools around Singapore, in some of the swimming coaches, gymnastic coaches, things like that. So they understand how important, right, movement is. When things are moving well and aligned well, that's going to help us adapt better to the stresses in our life. We have physical, chemical, emotional stresses that come at us every single day. So our body is better able to adapt to that. Like I mentioned a little bit previously, everything in our body is moving right now. Everything flows. Okay. So if you think about it, even from a cellular level, things are flowing in and out of our cells at all times. Okay. We come up to a little bit bigger organization from that. Our blood is flowing, right, from our heart around everywhere, back up into our body, okay, back up to the heart. And movement of our leg muscles, especially, is essential to get blood back up into the heart, okay? So even just getting the blood to flow, right, requires other areas to move. So if you have aunties, uncles, grandparents, right, who have a lot of that swelling in their ankles and their lower legs and things like that because they can't move very well, right? That's why they're getting that swelling, is because the blood is pooling down there because the contraction of the muscle isn't getting the blood back up. So there's the blood flow, right? Our breath flows, right? In through our nose, into our lungs, right? Our diaphragm, our ribs are expanding, things like that, and then it's flowing back out, okay? Our digestion, right? The food that we eat, it flows through our stomach, our small intestine, our large intestine, okay? So what happens when our digestive system, when food isn't flowing, or if it's not flowing correctly, right? That's where we get constipated. That's where people have diarrhea. Hormones, okay, especially for women, right? We have the cyclical flow of hormones, right, throughout our cycle. So they're supposed to ebb and flow, okay? That's going to lead to lesser symptoms, around that time of the month, so that things are more comfortable. So we don't have a lot of pain, a lot of cramps, things like that. I talk to a lot of our female patients about that as well. Okay, so we have the cyclical flow of hormones. Our nervous system, right? So the information to and from our brain, that needs to flow. And that especially we're going to get into more specifically a little bit later on. Okay, so things need to flow, they need to move. Now, lack of movement as well, that's going to affect how long we live and potentially the quality of that life. Okay, so again, another silly question, who here doesn't want to have a long, healthy life? It's very silly. We all do. Okay, we want to do the things we love, whether that's volleyball like myself, whether that's gardening, whether that's cooking, whether that's traveling, right? We want to be independent for as long as possible, right? So getting in and out of bed, right? Being able to use the toilet, going up and down stairs, right? If we want to be able to do these things by ourselves without assistance and without potentially falling down and things like that, we need to keep that movement. We need to keep that quality movement. So I don't know if any of you have heard of the blue zones. These are specific areas around the world that studies have found have the oldest and healthiest populations. Okay, and I've listed where those places are in case you guys want to go research those individually and things like that. But what it comes down to is with these 5 blue zones, what do they have in common? Okay, in addition to the way they eat, their social structure and things like that, one of the things that they have in common is that movement is a huge part of their daily life, right? They're getting up, they're moving, they're physically active throughout their entire day. Now, I know in our society and with different jobs and things like that, it's really hard to do that. A lot of our patients talk about that, right? We want to move, but I'm working at a desk job, right? I need to be seated for hours throughout the day. So we'll come back to that again a little bit later about what we can do to incorporate more movement into our life, okay? But regular movement has been found to help with longer life, better quality of life, okay? So when we break it down, not all movement in our life is considered equal, okay? So there are such things as good movement, there are such things as potentially bad movement. And especially anybody who's been to the gym or played a sport or things like that, you would know that with the terms of form and technique, okay? We need to have correct form, we need to have correct technique when we do things so that we're protecting, we're supporting our body, especially for repetitive movements. So for people who play racket sports or cricket, right, baseball, anything that really gets into the rotator cuff and the elbow, right, we need form for that. That's why a lot of those people have potentially like rotator cuff issues, elbow issues, things like that, okay? When we're doing deadlifts, deadlifts especially, and other things as well, right? Your trainer, people will tell you form, technique are important, okay? And so why they're important is because we need functional movements. We're going to go through this column on the left side first. So what is functional movement? Functional movement is when we move with the correct biomechanics. Biomechanics is the way our body moves, okay? So the correct biomechanical patterns for the most efficient, pain-free movements that are going to give good information to and from our brain, okay? So another word that you guys may or may not be familiar with is the term neuroplasticity, okay? Neuroplasticity. And what that means is that our brain is constantly adapting. It is constantly learning things. It is constantly creating new patterns, new synapses and things like that, because our brain likes patterns. So when it gets enough of the same information, it's just going to more quickly go down that same path to do that same thing, right? So you think again about learning the systems that work, learning a sport. So at the beginning, you really have to consciously think about what you're doing, how you're moving, or the specific tasks throughout your day at work and things like that. The more often you do it, you don't have to consciously think about it anymore. Your body knows what to do, okay? So that's that same thing, neuroplasticity. When we learn that pattern, we just automatically go down that pattern, okay? So we want good information so we have good patterns, okay? So those functional movements, okay, that are going to be based on what we need to do throughout our daily life, right? There's going to be squats, right? Sitting, going from sitting to standing, things like that also, right? Using the toilet, that's a squat, okay? We need to be able to lunge, hinge, push, pull, okay? The way we rotate. Gait is talking about the way we walk, right? Our movement. That's everything from how our feet and ankles are oriented to our knees, everything up, okay? So those are all these movements, right, that we want good movements, okay? So when things are not moving the way they should, right, when they're not moving with that efficient, pain-free, good neurological input, then we're having what's called aberrant movement, okay? So basically, like I said, kind of bad movement. So that's when we're getting bad, incorrect patterns. So that means that the information that we're sending to the brain is not good, right? So we're getting bad patterns. So then we're going to more quickly default to those types of patterns, okay? And so over time, that's going to lead, like I was saying, to that change in neurological information. So that's the template right up here. That's going to lead to pain because we're going to wear things down differently. It's going to cause irritation, which can lead to inflammation. Like I just mentioned, it's going to cause wear and tear because things are moving differently in relation to each other. So we're going to get degeneration faster. And then it's going to change movement patterns elsewhere in the body, okay? Because our entire body is connected. So if one area isn't moving properly, it's going to affect the other areas around it. I was actually just talking to one of my colleagues today. He asked me to look at his ankle because he was having ankle pain. And he's like, well, I'll have you look at my ankle and then later you can adjust me because my low back doesn't feel so good either. So we adjusted his ankle. And then before I left to come do this talk, I was asking him as well as, okay, well, do you need to get adjusted? He's like, oh no, my low back feels great. Because studies have shown as well, research has shown that when we have restrictions, when the ankle's not moving the way that it should, it can cause pain up into the low back, okay? So everywhere in our body is connected, okay? That's not saying every instance of low back pain is caused by the ankle, just saying some of them are, okay? So it's just interesting how each area can affect other areas where you wouldn't necessarily think that that would be the case. All right. So for us to move forward and understand how we then are going to assess and potentially improve our quality of movement, we need to learn about the body and how the body is supposed to move. So that's where we're going to go next. So I have some pictures here, and you can see on this right picture, The spine is highlighted in kind of that orangey yellow gold, okay? Now, our spine is known as the axial skeleton. The arms and legs, the things that attach to it, are called the appendicular skeleton. Okay, you don't need to remember that. There's not going to be a quiz or anything. Okay, but we're going to focus on the axial skeleton. That's what I want you to know. So we're going to focus on the spine. Okay, because the spine is where everything else attaches. So it's super, super important. Okay, so with that, we have 6 basic ranges of motion for the spine. Okay. So we have flexion, which is bending forward. We have extension, which is bending backwards. We have rotation to both sides. And we have what is known as lateral flexion or lateral bending to each side. Okay. So those are the 6 ranges of motion in the spine. Now, we want the whole spine to be moving well and moving together. But in order for that to happen, we need each of those segments in the spine to be moving the way that it should as well, okay? Because if it's not moving well at certain segments, that's going to affect global movement, okay? So we're going to break the spine down. So the first part of the spine that we're going to talk about are the vertebra, the bones. And I have a model over here, which is easier to show you, okay? So we have the bones. Now we have 4 different regions of the spine, 3 that we're going to focus on, depending on where we are in the spine. So the neck area is also known as the cervical region. The mid back is known as the thoracic region, and the low back is known as the lumbar region. So anybody who's had x-rays, MRIs, things like that, you've heard one or more of those terms, okay? So depending on the region that we are in the spine and the body, the vertebra, those bones, are gonna look a little bit different. The sizes are gonna be a little bit different, but for the most part, they're built the same, okay? So we have what is known as the body, the big part. We have different structures going towards the back, okay? A lot of them that kind of protrude and point out. So those are important because that's where muscles, tendons, ligaments, and things like that are going to attach. Now, the soft tissue, the muscle, tendons, ligaments, very important, okay? But today we're gonna focus more on the bones. We're gonna focus on the disc in between as well, okay? So focusing on the bone, we're gonna go through different joints in the spine, okay? This is just going to be a brief overview, and then we're going to focus specifically on a couple different types of joints in just a moment, okay? So again, just a reminder, you don't need to memorize this. This is recorded. You can come back to this later, I promise, okay? Now, one of the ones that we're going to come back to and focus on in a little bit, okay, is this first one. So that's pronounced zygapophyseal joint. Zygapophyseal, also known as a Z joint or a facet joint, okay? So for ease of terminology, I'm going to call it a facet joint, okay? So the facet joint is going to connect one bone from the top to the one at the bottom. So a joint is where 2 bones come together for the purpose of movement in the body, okay? So you can kind of see how, like I said, this part that kind of sticks down, this part comes up, how they're going to move together. That's going to help with flexion and extension. Okay, now these are going to be oriented slightly different ways in different regions of the spine. So it's going to help with some certain movements in some areas of the spine. It's going to limit certain types of movement in others. Again, the specifics of that is not important. If you're doing anatomy and physiology, let me know. I'm happy to go into more specifics. But for the purposes of today, that's all we really need to know, is it's going to help things move specific ways in specific areas of the spine. Okay. Now, the second one down here is also important. It's called a sacroiliac joint. Now, our sacrum is what a lot of people also like to call their tailbone. And then it's going to connect our sacrum to the tailbone on either side. And I actually have that right here. Okay. So we have our sacrum, we have our pelvic bones on either side. So these joints in between are our sacroiliac joints. Now, a lot of times people will come in and say that they have hip pain, okay, but they don't point here, they point there. So it is very common, especially for people who sit for a lot of their day, to end up having pain at their sacroiliac or SI joints, okay? So the way that these move is very important as well. We can dive a little deeper into that in just a while. Now, these next few, like I said, I'm going to go through with you. We're not going to focus on these hugely. So the next one is called a costovertebral joint. So costo is talking about the ribs. Vertebra is talking about that bone. So it's where the rib and the bone connect. And that is going to be in the thoracic region because that's where our ribs are. Okay. Now, those are very important. We want those aligned properly because our ribs move as we breathe, okay? So when people come in and they say, you know, like they can't take a full breath in, or they have pain with a deep breath in or a deep breath out, it's usually because we have misalignment of the ribs or the rib joint, okay, which is then causing pain in the muscles in between. So again, costovertebral, that's important for our ribs, making sure that we have proper rib movement. The next two are the atlanto-occipital and atlanto-axial joints, okay? Excuse me. All right, so the occiput is the base of our skull. The atlas is the first bone in the neck. And I'll see if I can kind of get you guys to see this better. Okay, so our occiput, our atlas, okay? So where these are come together as a joint here and on the other side that you can't really see, okay? So that is important, excuse me, for flexion and extension at that joint, okay? That's the biggest movement we have at that level. So if you think it's kind of like nodding yes and no, that's that movement. Now the second one, atlantoaxial, that's between the first bone in the neck and the second bone in the neck. So the second bone is called the axis. So the atlas and the axis. Now the atlas is different from other bones because it has this protrusion in it, and the atlas is going to rotate around that. So the biggest movement we have at the atlantoaxial joint is rotation, okay? Oh, so right, so we're nodding yes for atlanto-occipital, no for atlantoaxial. So those are very important joints because when they're not moving properly, excuse me, just one moment, okay. When they're not moving properly, this is where the spinal cord starts, okay? You can see it's going to be very closely related to the brainstem as well. So when things aren't moving properly, if things are restricted, if it's putting pressure on structures up here, that is a very common reason people get headaches, because the nerves that go to the muscles in the head come out in that area. Okay, so a lot of times the patients that we see who have common headaches and things like that usually have some misalignments going on up there. That's why those are important. Now, the last one on this slide is called an uncovertebral joint. Okay, and that is a very specific joint in the neck because the neck is the only place that has these. So as you can see kind of on the picture here, and then I'll get this guy close too. So you can see these areas where the bones are kind of pointing, kind of growing up, okay? That is known as the uncinate process, okay? Hence where the uncovertebral comes from, okay? So they grow up like here. It's going to articulate or create a joint with the corresponding area with the bone above it. And that's going to limit lateral flexion in the neck, okay? Now, the reason that that is important and that I put it on here today is because when we start to get wear and tear, when we start to get degeneration, especially with that joint, it doesn't have any space to put more bone down going up, okay? So it puts more bone down going sideways. And that can be very problematic because that's where the nerves come out. So people who have radicular or a radiculopathy, for those of you who have that, you would have heard that term. So who have radicular pain or radiculopathy, what that means is that they have traveling pain. They have pain that starts somewhere in the neck that then travels somewhere else. That is radicular pain. So those bones growing out in that direction are the ones that most commonly cause radicular pain from the neck into the arms and things like that, okay? So like I said, those last four are very important, but we're going to focus on the sacroiliac and the facet joint today, okay? So those are joints. All right. Now, the other part of the spine that we're going to focus on are the intervertebral discs. Inter meaning between, vertebral meaning the vertebra, so between the vertebra. So I'm just going to call them discs from now on to make it easier, okay? And that's the soft tissue in between the bones in the spine, okay? Now, these are important, and they have two distinct parts, okay? They have what is called the annulus fibrosus and the nuclear pulposus, okay? So the outer part, the annulus fibrosus, it's fibrous, okay? So it's tough, it's made of many layers of tough fibers, okay? The inner part the nucleus pulposus, right? You think pulpy, so it's going to be softer. It's going to be more like a gel. So these are important because they're going to help with compressive forces in the spine. So that's when we're weight bearing, right? So either when we're sitting up, when we're standing up, when we're doing other exercises and we have forces coming in this way, okay? That's what those specifically help with. Now, the nucleus is going to help in other ways because when we're in different positions, it's going to help distribute those forces throughout the disc, depending on what position that we're in, okay? So again, you can see how things moving properly, being aligned properly is going to be important for that, okay? So those are the parts so far, right? The vertebra, the different joints, the bone, the disc, okay? We're going to come and talk about what happens when those aren't aligned properly a little bit later on. All right. So how does our spinal health affect our overall health? Why is me telling you about the spine important? Now, it's important because it is directly connected to our nervous system. And our nervous system starts with our brain, which you can see right here in the PowerPoint. Our brain is telling everything in our body constantly what to do. It's receiving information. Based on that information that it receives, it's giving instructions, okay? So our brain is, if we think of our body as like a computer, right? That's going to be the CPU, the central processing unit. So our brain is very important. So our brain is sending and receiving those signals through our spinal cord, which goes from the base of our brain all the way to our tailbone. Now the brain, the spinal cord are both very important. They're both potentially vulnerable. So they're both protected by bone, our skull and our spine, okay? Now, at every level in our spine, we have nerves that branch out, okay? And they're going to go everywhere, to every muscle, organ, cell, and tissue in our body. So like I said before, they're constantly sending and receiving information to and from the brain, okay? So for our body to be as healthy as possible, to feel as good as possible, to move as well as possible, we need that constant, uninterrupted communication to and from the brain. So like we were talking about earlier, we have physical, chemical, emotional stressors in our lives. So when we are unable to resolve that stress in our body, okay, over time, that's going to lead to dysfunction, things not working the way they should. All right. So some of the ways that dysfunction is going to show up, or that's going to lead to dysfunction, is when these areas are not aligned properly and or not moving properly, okay? So you remember this top middle one from a couple slides before, okay? So this is gonna be our normal or ideal. Now, the bone of the spine and the disc create the space where the nerves are gonna exit the spine, okay? So we want as much space as possible. When we're looking at these pictures, when we're looking at this model here, it looks like it's fine that the nerve is the only thing that comes out, but that's not true, okay? There is no such thing as free space in the body. So not only are the nerves coming out here, but we also have blood vessels, we have connective tissue, right? We have different things in this area coming in and out of that area, okay? So if things are misaligned properly, not moving properly, it's not only going to affect their nerve, it's going to affect other things as well, okay? So for the example on the left, what's going on there is that things have misaligned, okay? So one bone has shifted backward in relation to the other one below it, okay? Now, usually bones are actually going to move and misalign in more than one direction. So it may have shifted backward, it might wedge to the side. Now you can see the more ways that I misalign this, the smaller this space where the nerve comes out. And that's what it's showing with that red and green color, okay? So that's the flow of information through the nerves. So if we're making this space smaller, okay, which is also going to irritate it, right? Because things are wearing differently. When we get irritation and inflammation, part of inflammation is swelling, which means that fluid is going to come to this area as well, which is going to create more pressure on those structures as well. All of that together is going to cause pain, okay? So that's one of the reasons we can get pain at different areas in the spine. Is when we have misalignments, putting pressure, irritating things, causing inflammation, okay? Now, the example on the right, that's focusing more on the disc, okay? Now the discs act like sponges, okay? So at night when we're sleeping, they absorb water, they absorb nutrients, Okay, they get nice, big, and juicy. So fun fact, we are at our tallest at the beginning of the day as soon as we get out of bed. Okay, during the day as we're weight bearing, as we have gravity acting on us, it slowly squeezes that water and those waste products out. Okay, so that at night before we go to bed, we're our shortest. Okay, now, like I was saying before, we have layers and layers of tough fibers here. But if things are misaligned, if they're wearing improperly with those movements and things like that, over time, some of those fibers, they can start to weaken and they can start to tear. All right. Now, when that happens, when we start to get tear, it's not going to act like a sponge, right? It's not going to be able to hold water, hold those nutrients as well as it did before. So it's going to start looking smaller compared to the nice, big, healthy, juicy discs around it. Okay. So again, if you've gotten an X-ray or an MRI or something like that done, the doctor may have pointed out where some are looking smaller than the others. Now, if we continue, if that stays in that stuck in that misaligned and that not moving well position, if it stays there, we're going to get more stress, more irritation in that area. Those fibers, things can continue to tear. Now, like I mentioned before, the nucleus, the inside part, it acts like a gel. Okay, a gel is going to be more similar to a fluid. Okay, now fluids, water especially, like things like that, if you think about that, it follows the path of least resistance. So if we get more tears in one area, the nucleus is going to push out more in that direction. Okay, so when it's pushing out, if it pushes out past the kind of like the end area of the bone, then it can put pressure on the nerve. It can put pressure on the spinal cord. It can put pressure on different structures. That's what's known as a disc bulge. Okay, it is bulging out past the margin, past the border of the bone. Okay, now if that last layer of fiber tears and the nucleus is able to come all the way out, that's what's known as a disc herniation. Okay, now in Singapore, there's kind of an umbrella term really for any kind of disc issue, which is known as a slip disc. So if you've been told that you have a slip disc, okay, I can't tell you exactly where it is unless you come in and see us, but likely, right, we have at least a bulge going on. Okay, so that's why we want things aligned properly. Why we want things moving properly in those areas, because over time, those are major reasons why the people that come in and see us have pain in those areas, because things are misaligned, they're restricted, they're not moving, which is causing irritation and things like that over time. Okay. All right. So when we get to that point, because things can be misaligned for a while, for years even, before we start having pain, before we start having symptoms. But when we have pain, if we don't do anything about it, we're just going to have this cyclical process, okay? A vicious cycle, if you will, okay? So it's going to affect us in multiple different ways. So we'll start on the left with the psychological changes, okay? So when we're in pain, right, that makes us express bad emotions, right? We get anxious, we get angry about it, right? Nobody likes being in pain. That's not a pleasant sensation. It's not a pleasant way to live, okay? Which is going to, when we're not feeling good or we're not feeling happy, right? We don't necessarily want to be around other people. Also, if we're in pain, we don't necessarily want to move. We just want to go home after a long day of work and things like that. So we're not necessarily interacting with the people around us as much as we did before. Okay, that can lead to us, of course, being in a better mood, excuse me, not as good a mood. Okay, we have a lot of people on our entry form and things like that, right? You guys may have yourself. We're like, hey, I'm more irritable, right? I kind of snap at my family, things like that, right? Okay, and then that can lead to depression and things like that. With all of these things are going to lead to an increased perception of pain. Okay, not necessarily that we're having more pain, but we're going to be more and more aware of it because it's going to be more top of mind. Okay, we have that as well when people come in and they're like, well, when I have something to do, when I'm working, I don't think about it. But then when I go home, right, it's just there and I can't do anything else because I'm just in pain. Okay, so that's the psychological cycle of pain if we don't do anything about it. Okay, shifting over to the right side to the physical aspects of it. Okay, again, starting at the top. When we're in pain, we're going to avoid the movements, we're going to avoid the activities that cause us pain. Okay, and unfortunately, our muscles decondition a lot faster than they condition. Like I said, it's very unfortunate, but it's true. So when we're not being as active, right, our muscles, we're going to lose muscle tone. We're potentially going to increase fat deposits and things like that, right? So things are going to decondition. So then when we potentially start doing activities and stuff again, right, because we're deconditioned, okay, we're like, oh, well, this is, is painful or more sore and things like that, right? Not feeling good. So then we're going to further avoid those activities because it's causing pain. It's going to lower our pain threshold. So again, not just that increased perception of pain, but now we're more sensitive to pain, okay? And that's going to lead to that whole thing, okay? So pain is our body's way of telling us that something is wrong. Pain is never normal, okay? It is never normal. It is common, but it is not normal, okay? If I had a nickel for every time someone came in and said, oh, it's just a normal kind of pain, it's a 1 to 2, it's okay, I can live with it, okay? Well, for every person that came to us who's already at a 10 out of 10 pain and is, just having a terrible quality of life because they can't move, everything hurts, everything's painful, everything's terrible, they started at a 1 to 2 out of 10 as well, okay? So we don't want to wait for things to become excruciating before we do something about it, because your body is trying to communicate with you, is trying to tell you what it needs. So we need to learn to listen to it. All right. Now, not only can dysfunction show up as pain, but it can show up in other ways as well. Okay, so this was from one of the earlier slides as well, showing that our brain, our nerves connect to everywhere in our body. Okay, so if things are misaligned, if they're not moving well, yes, it can cause pain and things like that, but it can also cause headaches, low energy, fatigue, trouble sleeping, sinus allergy issues, heart issues, breathing problems, digestive problems, menstrual irregularities. Okay, it really just depends on where we have that interference, where we have that lack of good movement, things like that, where the nerves in that area go to. Okay, so pain is not the only way that dysfunction shows up in the body. Now, before we can recognize if something is misaligned, not aligned properly, not moving properly, kind of like we did before, we need to know what it is that we want to see. Okay, so when we're looking at our spine, okay, and it's showing on here as well from the front, from the back, I think we all are aware that we want that to be as straight up and down as possible. We want our pelvis, our shoulders to be level, to be stable. Okay, what people are less aware of is that when we look at our spine from the side, okay, whether from the left or right, which is showing both on here, we want to see curves. We want the neck, the low back curving forward. We want the mid back curving backward. Okay, we want all those curves right on top of each other because those curves are going to act like springs, right? So as we're sitting here, we have gravity acting on us. As we do the different exercise and activities that we like to do, we have different forces coming into our body. So we want to be able to absorb and disperse those forces in a good, healthy way, right? Remember we were talking about earlier, we want our body to adapt in good ways, okay? So the closer we are to this ideal, the better our body is going to be able to adapt to those, the better it's going to be able to move, to disperse and use those forces, okay? So how can our posture, how can our alignment change in our body? Okay, how can it go from this to something totally different? And the answer is over time. Okay, now with the physical stresses in our life, those are going to fall into 3 major categories. This is the first one, known as common repetitive traumas. It's those seemingly little things that happen every day that are going to add up over time. Okay, now, a lot of people, when they come in and they see this one in the bottom left corner, they laugh and they chuckle. They're like, oh, yeah, that's me. Okay. When you're working at a computer, right, you get tired, right? You get here, everything's pulled forward. Okay. Again, like we were talking about earlier, our body likes patterns. So if this is the pattern, if this is the position you're giving the information to your brain every day, this is what it's going to go to, right? This is going to be your default. Okay. Hence why we get those uncles and aunties, right, that have that hunch, right, that have that really bad forward head posture and things like that. That doesn't happen overnight. It happens with time gradually, okay? Now, this gentleman in the top left corner, okay, exercise is good, right? Okay, like we were talking about earlier, okay, there's a difference between good movement and bad movement. Yes, exercise is good, but if we don't have the correct form, the correct technique, it can turn a good stress into a bad stress, okay? So for this gentleman, I think we can all recognize, look how much curve he has into the mid and lower back, okay? Over time, especially depending on how far he's going and how often he does that, right, it's going to lead to that mid back being curved out more than we want it to, which is going to lead to potential pain issues over time. It's also going to put him at higher chance of injury as well. Okay. So that's another thing. When things aren't moving well and things like that, it makes us more likely to have an injury, and that is not fun. Okay. The second category are going to be those major traumas in our lives. Okay. So slips, falls, car accidents. I mentioned I've had a couple of those in my life. Something that people don't necessarily think about is the childbearing process. Okay. Whether it's for mom or for baby, that is a very traumatic process. Okay. So whether you give birth, like people like to say, the natural way or via C-section, both of those are traumatic events for the mama. Okay. Those can cause things, especially the pelvis, the low back, to shift, to move, and things like that. Okay. Also, when it comes to epidurals and things like that, okay, where they put the epidural, they're putting that needle right through this space in the bone into that area by your spinal cord. Okay. So there's a very small margin of error. Okay. I have had several people come in as well who've had low back pain ever since their epidural and things like that. Okay. So we just, lots and lots of different things can cause pain and discomfort and things like that. And last but not least, okay, this is kind of a combination of the first one as well, is either heavy weights and or improper weight distribution. Okay. So like we can see with this woman to the left holding the baby. So she already doesn't have great posture, right? And then when we sit baby right on front and then we alter our posture as well, okay, that's going to distribute those forces in different ways as well. And the more often we do that, right, the more it's going to cause things to move differently, wear differently, right? Things like that potentially cause pain. Okay, when we're lifting laundry basket, right, groceries, things like that from the floor. Okay, again, coming to the deadlifts and things like that. We want to move, we want to hinge, right? Remember that from the functional movements, we want to hinge at the hips and not from the low back. Okay, that is very important. So when we're doing those types of things, that's how we protect our low back. Okay, is hinging from the hips instead of the low back. Okay. I did find out when I moved here that Singapore does not have lockers for kids in school. Okay, so they're having to carry very heavy book bags to and from school. Okay, I used to have a closet full of high heels, which I don't anymore, but I used to. Okay, had lots and lots of them. Now, high heels are great. They look great. They're fun to wear, things like that. But again, they distribute our weight differently than what is ideal. So the more often we wear them and things like that, especially when we already have altered posture, altered alignment, things like that, again, it's just going to lead to more issues. Okay, so all these things we need to be aware of over time. So what does all of this mean for us long term? As we talked about, dysfunction can show up as pain. Okay, when we're in pain, we don't want to move, right? So it can lead to decreased range of motion, either because it's painful or because it's not moving as well as it did before because it's not aligned properly. Okay, so when things aren't aligned properly, they're not going to move properly. So it can alter our range of motion through those different ways. Okay, it can show up as things not working as well as they did before, whether that's our joints, our organs, things like that. Okay, that is literally the cause of disease, is the organ or structure not working the way it should. Okay, you think about diabetes, it's because the cells aren't recognizing a specific hormone, insulin, to let sugar from the blood into the cells. So then the pancreas is pumping out more and more insulin to the point where it just gets fatigued and then goes kaput. Okay, can think about, like we were talking about earlier, when the gastrointestinal system isn't moving properly, right? That's going to lead to constipation and diarrhea. If we get backup of things long enough, like little pockets of bacteria and fecal matter and things like that stuck in different areas of our intestine, over time, that can lead to different types of diseases that can actually lead to some types of cancers. So, like I said, any type of disease is really just that part of the body not working the way it should. Okay, so we want things working as well as they can for as long as they can. Okay, when we think about it, any machine, whether it's a car, a bicycle, a train, things like that, okay, of course, when it's 50, 60, 70 years old, it's going to be working differently than when it was brand new, but how well it's working is going to depend on how well we maintained it during that 50, 60, 70 years. Okay, So those are very important. Let's see. Now, we mentioned before how things are going to wear differently. Okay, now wear and tear, degeneration, osteoarthritis, those are all terms for the same thing. Okay, so what happens when things wear down, when they degenerate, things like that? The shape of the bone and the shape of the disc are going to change. Okay, so when things get aligned improperly, it inherently makes that area, either at that segment or in that region, less stable. When the body is less stable, like we said, it wants to adapt, and it says, how can we make this more stable? Okay, now the strongest material that we have in the body is bone. So in the short term, to make things more stable, it's going to tense up the muscles around that area. Okay, now you can think of that as well. So many people, again, oh, I go get massages, I do acupuncture, I do cupping, right, which helps temporarily, but things just lock up again. Okay, so that's probably why, right? The body's trying to keep things stable. That's how it does it in the short term. In the long term, the body is going to start putting down more bone. Okay, and again, you may have heard that term, bone spurs, osteophytes, right? That's the term for this bone growth of more than what we want. Okay, now, as you can see, as we look at these models as well, the more change we have to the shape of the bone, the shape of the disc, okay, how well is this going to move in relation to the nice healthy ones, right? We have a lot more available movement here. Okay, we also have a lot more available space where those nerves come out. So when we have things degenerate, wear and tear and things like that, it not only affects the bone, the disc, it affects the nerve, the other joints, things like that. It affects how much range of motion we're going to have. If things are more painful, things like that. Okay, so again, anybody who's had x-rays and things like that, you may or may not have seen some of those on your x-rays. Now, when we have irritation over time, it can lead to other kinds of arthritis as well, rheumatoid arthritis, psoriatic arthritis, things like that. Those are going to be tied in with an inflammatory process as well. Okay, so chiropractic, which we'll come to in a little while, can help with that, but especially for those inflammatory ones, of course, you know, you're going to want to see a GP and things like that. Okay, like we talked about, it's going to affect not only how the body moves, but how the body can move. It's going to affect that nerve flow. It's going to affect the flow of everything, right? If we have bad posture, things like this, right, we're not going to be able to breathe as well, right? We're not going to be able to get the heart beating as well. So we want better posture, better alignment, so things can flow, things can move. All right. So with all of this information, what can we do about it? Okay. Now, just like anything else, in order to change something, right, it's going to take education, it's going to take action. Okay, more specifically, right, with education, before we can solve a problem, we have to identify what the problem is. Okay, so we can do a quick self-assessment here, and you can raise the hand in the chat if you want to. You can just keep a mental tally if you want to, that's okay. But I want you to really sit and assess, do any of these apply to you? Okay, and think about that. So, are you currently in pain? Okay, yes or no? You can kind of self-assess. Are there different areas? Are there pains with certain movements and things like that? Okay, like we talked about before, pain is not normal. Pain is your body's way of telling you something's not right. It's like saying, hey, we need attention in this area. Okay, does the absence of pain, thank you, Alan, I like the hand up. Okay, does the absence of pain mean everything is okay? And the answer is no. Just because we're not in pain doesn't mean we don't have issues going on. Okay, so thinking about it, do you have restricted movement? Okay, are there any movements that you find that you can't do or are more difficult to do? Okay, think about that with one side compared to the other. Is it easier to move to one side? Is it easier to do certain movements than others? Okay, do you have pain with certain movements? Okay, think about that. Okay, this one comes into the work and things like that, right? See, everybody's like, yes, yes, yes. Okay. So are you in the same position for several hours a day? Okay. Now, whether you were in the office at a computer, right? Had someone come in the other day who's a designer, right? We have people who make jewelry and things like that that are going to be in the same position for hours and hours, right? If you work at a grocery store, things like that, right? The people at the checkout line, okay? There's lots of jobs and lots of things that require us to be in the same position pretty much the entire day. Okay, our bodies are made to move. They're not made to stay in the same position for hours and hours at a time. With that being said, if you are in the same position for hours, do you consciously make an effort to take breaks, to get movement, to stretch into your body on a regular basis? Okay, just so you guys know, the goal that I want you to shoot for is every 30 to 60 minutes. Okay, our body needs to move. And I know some of you might be thinking, that's crazy. How can I possibly move every 30 to 60 minutes? Okay, I know you're busy. I know you need to get things done. But believe me, taking breaks, getting movement in there is not only going to help you physically, it's also going to help you mentally, because our brains can only efficiently focus on something for so long. Okay, so taking regular breaks, and it doesn't, I'm not saying take a 20-minute break. I'm saying take a minute, go get some water, go to the toilet, do some stretches at the desk. Okay, it is going to make you more productive over time. I know this seems counterintuitive, but it is true. Okay, all right. Ooh, this is a good question. Have you seen in pictures of you or in the mirror, or have you been told by someone else that your posture is abnormal, right? Do you find that your head is always tilting to the same side? Do you have one shoulder that's higher than another? Okay. I've had someone tell me they feel like their rib or their hip, one of them seems more prominent than the other, which is telling you you have some rotation going on. Okay. Oh, this is another one as well. Is your belly button midline, or is it more off to one side? Okay. If you were to lift your shirt and look at your waistband, would it be level, or is it going to be higher on one hip than the other? When you're standing in what you feel like is a natural neutral position, do your feet point forward? Do they point out? Do they point in? Does one do each? Right? That's potentially going to tell us that we may have some alignment issues at the pelvis as well. Okay. So just with those few questions, several of you already have an idea, right, of that you may have some restricted movement. You may have some things that you might want to look at, you might want to get into. Okay. Continuing, like we were talking about, are some movement stretches easier on one side than the other, right? Do you potentially have some imbalance? Does one side fatigue faster during the other side during exercise? Okay, that's something I'm currently working on as well. When I do shoulder exercises, I find that this shoulder with certain movements gets tired and fatigued a lot faster than this one does. Okay, so I have some imbalance from side to side. Right, just so you know, even doctors, even chiropractors aren't perfect. Okay, we're all human. So depending on how you answer those questions, you may have some signs that there are posture, their alignment, and thus movement issues going on in your body. Excuse me. Okay, so that's part of the education about it. Okay, so let's look at the action. So how do we get things back towards where they need to be? Okay, number one, we need to change habits. So habits are what got you into the current alignment, into the current posture, things like that. Okay, so again, like we talked about, moving more often, being able to identify, learn about like the bad movement patterns and or muscle imbalance patterns, improving your ergonomics, like all of these things. Okay, now a lot of that you can do the research on your own. There's lots of blogs and health influencers and things like that. Like you can go down the rabbit hole. Okay, but it is a lot of information, and it's sometimes hard to sift through and see what is valuable and what is not. Okay, and that's where that second bullet point comes in. Okay, it may be useful to get some professional help. Okay, so for those of you who are patients, right, you've already taken this step and things like that. For those of you who have not come in to see us at Total Health or gone to any other chiropractor, right? Okay, whether it's a chiropractor, whether it's a personal trainer, whether it's a physio or things like that, okay, there are going to be differences to all of those approaches and things like that. The thing about chiropractic care is that we look at how the whole body is moving together. Okay, we're not just going to look at one area, one movement, and just focus on that area of the body. We look at all of it together. Okay, we will talk to you about multiple things as well, right? Not just movement. We can talk about nutrition and other things going on. Okay. Like it says here, we take a multifaceted approach. So we're not just going to do chiropractic care. We're also going to give you some home exercises and give you some tips on ergonomics and things like that, so that you can change those things and work on changing your habits and things like that as well, so you get more improvement faster. Okay. So with that being said, I'm not an authority on the other professional help, but I am on chiropractic. Okay. So a lot of people, again, if you are currently a patient, that's wonderful. You can tune out for just a minute before we go to questions. If you are not, Okay, you may have questions, right? People are kind of anxious about what they don't know. It can be scary, especially if you've seen some of those videos on YouTube. Okay, so a lot of people do have questions about what is chiropractic. Okay, what is it that we do? What is it that you can expect? So the bottom line, big picture of chiropractic is that we help to optimize the health of your nervous system, right? Your brain, your spinal cord, all your spinal nerves, okay? And thus your body by getting your spine as close to that ideal alignment as we can, okay? So like we talked about, when things are aligned better, when we're getting better information, right? And better neurological patterns as well, all of that helps movement, okay? So a chiropractic adjustment is a specific application of force into the body with the intent to restore movement, alignment, and nervous system flow. Okay, so one more time, a chiropractic adjustment is a specific application of force into the body with the intent to restore movement, alignment, and nervous system flow. Okay, now one chiropractic adjustment isn't going to fix everything that's going on with someone's body, right? Especially if when we're in our 30s, 40s, 50s, things like that, okay? Just like anything else, it is a gradual process. It takes time, it takes repetition. Every adjustment is gonna build on the last one, okay? Now, something that first timers ask me as well is it painful, okay? So that's kind of a yes, no question. So if you are currently in pain, if that area is inflamed, is irritated, and things like that, okay, when we put that temporary application of force into that area of the spine, it may temporarily increase the pain and discomfort, okay, which should go away pretty quickly. So if you are currently in pain with that temporary increase of force, it may temporarily be more painful, but the adjustment itself is not painful, okay? So if you are not in pain and you get an adjustment, it is not painful. If you get an adjustment and it is painful, talk to the person who just adjusted you, because it should not be painful, okay? Now, who benefits from chiropractic care, okay? So the short answer to this is chiropractic care is for everyone. It is for people who have pain. It is for people who don't have pain, right? Because if you want to Google it, chiropractic care and professional athletes, there are so many professional athletes that swear by chiropractic care. It just gives them that extra edge in their game and their performance, things like that. Okay, so for people who are in pain, people who are not in pain, it's for babies, it's for aunties and uncles, okay? I don't know about all of the other clinics, but I know at our center in Tampines, our youngest patient right now is 5, our oldest patient is 91, okay? So the way that we adjust people is going to be different depending on the age, right? Depending on their needs and things like that, okay? So obviously the way that we adjust our 5-year-old and our 91-year-old compared to with like our 20, 30, 40-year-old people, it's going to be totally different, okay? But chiropractic is for everybody. And there are different techniques, different ways to adjust depending on needs and depending on preferences, okay? So again, people come in, they've seen videos on YouTube, they're like, is this what chiropractic is, okay? Or they may have a fear of the adjustment in the neck or things like that, okay? Like I said, there are different ways to adjust and to achieve the same thing in different ways if necessary. There's lots of different chiropractic techniques and things like that. Okay, so that is the basic overview of what chiropractic is. Now, what to expect at a potential first visit to our office is when you come in, right? I kind of talked about how you would fill out that intake form, which is really true for any healthcare visit office and things like that. Okay, we're going to take a posture assessment. We're going to look at weight distribution. Okay, you're going to have a conversation with one of our doctors of chiropractic, and I have pictures here. So the top one is Dr. Tim. He's at our CBD location. He's one of the owners. The bottom one is Dr. John. He's actually the lead chiropractor at my office. I work with him. They're all great, okay? So you're gonna sit down with one of us doctors, okay? We're gonna talk to you about what's currently going on, right? What brought you into the office. We're gonna talk about your health history, all the different things that have gone on. We're gonna give you a physical exam. We're gonna look at range of motion, right? In all the different areas of the spine, okay? We're gonna do what is known as static and motion palpation. So we're going to feel through your body. We're going to feel how the joints are moving, if they're gliding, if they're stuck, if they're painful. We're going to feel for the muscles, if they're relaxed, if they're tense, tight, if they're imbalanced, if they're painful, things like that. Okay. If necessary, we're going to do some orthopedic and or neurological tests just to make sure that chiropractic would be the right place for you. Okay. After that, we would give you what we call an exploratory adjustment. Okay. So this is the adjustment on your first visit. it's not going to be the same as your adjustment on subsequent visits because we don't have x-rays yet, which I'll get to in a moment. Okay. So for that adjustment, the goal really is just to increase movement in the different areas. It lets us know how things are currently moving in your body, how your body might respond to chiropractic care. It lets you see what a chiropractic adjustment is like, what to potentially expect from chiropractic care. Okay, so it gives us kind of that introductory information. It is a lot more, well, I want to say gentle, not that they're hugely aggressive, but it's just, it will be kind of a more low-key adjustment than in potential future visits and things like that. Okay, so like I said, that gives us an idea of what's going on. Now, in order to come up with the specific recommendations for everybody that comes in, okay, unless you're a pregnant woman or a child, okay, or unless we have red flags for a child, okay, we x-ray everybody, okay, except for those two categories. Because x-rays allow us to physically see your spine. They let us see how things are potentially misaligned, how much, in what direction, if we do have any of that wear and tear, if there's anything that we need to be aware of, anything that might be a contraindication to chiropractic care, something that may be like, hey, chiropractic, not good, or just not in this area. Okay, it lets us know that. So then on your second visit, that's when we go over your x-rays with you. We go over those in detail, like I said, how things are misaligned, how much, in what direction, et cetera, et cetera. Okay, then we can give our specific recommendations to you, like how many visits, how often, what home exercises, et cetera. Okay, and then you do get a specific adjustment on that day. Okay, it's going to include a little bit more than the adjustment on the first visit. And then we take you through your home exercises so you can see what it is that we recommend. Okay, again, if you have different concerns and things like that, you can always bring it up because, like I said, we can work with you to either tell you or guide you towards resources to help you, like with your workplace ergonomics, with nutrition, things like that. Okay, because that's the thing, especially with total health chiropractic, okay, is we work with you as a team. So whatever your goals are that you want to achieve, we want to help you achieve those. Okay, so definitely let us know and talk to us. So if you are interested, or for those of you who are patients who have family members that you want, or friends that you want to share this information with, okay, we do have a promotion for you for coming to this webinar. Thank you so much. I appreciate your time. I really do. Okay, so you can scan this QR code for that, get a really great deal for that first visit. Okay, so if you have any questions specifically about chiropractic care, can definitely email Dr. Tim. So that's our general email as well, drtim@totalhealthchiropractic.com, to find out more about us or the different locations and things like that, or about specific conditions and whatnot. You can go to our website as well. Follow us on social media. We have a lot of really good quality information. Okay, and with that being said, we will go to questions. Okay, and the first thing that I see, ET, chiropractic allows my body to heal naturally. Yes, it does. Thank you, ET. Thank you for sharing that. I appreciate that. Okay, so I'm going to scroll up to the top. Okay, does it mean we shouldn't cross our legs? Now, when we do things like that, we really want to be aware, are we always crossing the same way? Okay, so are we always crossing our right leg over the left or vice versa? So if we're always putting ourselves in the exact same position, we either want to work on changing the legs, and so making sure that we have equal time over each, or just try to nix that habit altogether by trying to maybe cross at the ankles, or find a different position if you need like a little stool or something to rest your feet on. Okay, something like that. Crossing your legs isn't necessarily bad if it's always on the same side. Not going to be great, can lead to imbalances in the pelvis and the hips, things like that. All right, so Donald says, what do you think is the most basic movement that we should do on a daily basis, be it upper or lower body movement? That is a fantastic question. And I think I see Matt kind of gave you an answer to that as well. Walking, washing, basically everything. Okay, now that is true. And so what I tell people, especially from their first visit to do until their second visit and things like that, because that's a common question that we have at that time. So we talked about before, the basic ranges of motion in the spine are flexion or forward bending, extension, backward bending, rotation to either side, and lateral flexion or lateral bending. Okay, so doing that in the low back, which will help you do it in the torso as well, doing that in the neck on a daily basis, things like that. Those are good, solid movements to do. Okay, so that will help get in the spine. Now for the upper body, and I see a lot of people doing this when they're out doing their walking and things like that, right? Doing shoulder rotation and things like that, right? Moving the shoulder. Now the shoulders and hips are what are known as a ball and socket type joint, which basically just means they have a lot of movement, okay? And so we want to encourage that movement as much as possible, okay, within the shoulder, within the hip as well. So like I said, so getting that movement in your spine, just those basic ranges of motion are really good. For specific stretches and things like that, it would be more useful. I was gonna say, I can't really give you anything specific without seeing what's going on with the muscles, where things may be tight and things like that. Some good ones that are really useful for everybody. If you're familiar, or if you're not, you can Google this as well. The cat-cow in yoga. Okay, so that's going to get some good movement pretty much throughout the entire spine as well. Okay, we bring things into flexion and extension. I don't have space to show you, or I would. But like I said, if you Google that, there's going to be tons of videos that show you how to do that cat-cow movement. So you're going to work on it with your breathing as well. That's a good one. Just general body movement. As I think of more, I'll come back to that one. All right, but walking especially, yes, that's very beneficial and very underrated exercise. Walking is great. All right, so if there's scar tissue that affects range of movement. Okay, so that is a great question, actually. Okay, so I was gonna say, chiropractic care can still help with that to make sure that the joint is moving as well. For scar tissue specifically, that's where maybe some soft tissue techniques would come in handy. I don't know, we do have a physiotherapist. I don't know if she works with that, but there are some soft tissue techniques that get into the scar tissue because they can help it realign in a good way. Because the thing with scar tissue is if we don't kind of promote it to lay down in the way that things are going to move, it's just going to lay down all willy-nilly, right? And that's going to be what's affecting the range of motion. So there are different types of soft tissue. One of them is called Graston technique. Sorry, I'm not thinking of another one off the top of my head at the moment, but can specifically help with scar tissue and things like that, helping to kind of mobilize it, soften it up a little bit, help promote it to put down in the more kind of uniform kind of way instead of just kind of crazy and chaotic. Okay, but definitely with that as well, just working within the range of motion that you have is good, because especially with scar tissue and just in general, if we don't use it, we lose it. So just making sure that you just work within the range of motion that you have. Again, I can give you more specific information if I could do an exam and things like that, but that's just good general information. All right, shifting down. Okay. Lower back pain for years. Did an MRI scan and last 2 discs were black. Doctor said due to aging at 30 years old. Okay. Improved after acupuncture with a Chinese doctor and bed rest. Happened again 5 years after that. Lower back aches into the legs. Oh, lower back aches and felt leg weakness. When I moved from sit to stand position, must do it slow. Can chiropractic help? Okay. I'm going to say a tentative yes. Okay, you did give a good description there, but again, would need to do an exam and to see the radiology report and things like that before giving a definitive answer. Okay, so when it says the discs are black, when we take an MRI, there's a couple of different MRIs, but the ones that they're going to show you when you're looking at disc, when you're looking at the spine and the nerves and things like that, you want the disc, you want the nerves to show up as white or brighter, okay, because it's going to show areas that have water. Okay, so areas that are full of water and things like that are going to show brighter. So if the last 2 are showing up black, it's because it doesn't have as much water. So that is what is known as desiccation. Okay, it means it's dried out and things like that. Okay, so if the disc is desiccated, it does mean you did have early degeneration in that area. Okay, I'm 33 years old. I have disc degeneration, disc desiccation in those areas as well. Okay, now there's a lot of research that shows that chiropractic care is very effective in helping people with disc issues. Like I mentioned before, I am living proof that that is true as well. Okay, so chiropractic generally is very helpful with disc issues. Is it going to be specifically helpful with your disc issues? We would be able to tell you after an exam, okay? Now, something that I want to mention in regards to that question as well, right? It says, doctor said it was due to aging. Now, depending on the doctor you see, especially a lot of medical doctors will tell you that degeneration, that stress, that wear and tear, the change to the shape of the bone, the shape of the disc is going to happen because of aging. Okay, so for those of you who are patients or anyone else who has seen their x-rays, okay, you know that you don't see the same amount of wear and tear, you don't see the same amount of degeneration in your entire spine. So if that process were just due to aging, that's what we would expect to see. We would expect to see the same amount because all the bones in your spine, all the discs in your spine are the same age, okay? So especially when you're seeing that the lowest discs in your low back, right, are worn down, right, are the black on the MRI, it's not specifically because of aging, it's because of those potentially physical traumas and things like that that you've had previously in your life. Okay. Let's see, Matt just had gua sha. She used the fork on the breastbone saying there are lymph nodes there. Yeah, there are lymph nodes in the breast, in that area up into the armpit and things like that. There are lymph nodes in all different areas of our body. I don't know if you had a more specific question than that, but yeah, there are lymph nodes in that area, definitely. Okay, C4, C5 cervical fusion 9 months ago, still having stiff neck and stiffness and burning effect on right fingers and right palm. I've been attending physiotherapy and massage once every alternate week. Is this normal? Okay, no, sir, that is not normal. Okay, so unfortunately, with spinal surgery, whether it's in the neck or the low back, I don't have the specific percentage in front of me, but unfortunately, a significant amount of the time, those patients find, whether it's 6, 12, 18 months, 2 years later, a lot of times the same symptoms come back. Sometimes they come back worse, which is very unfortunate because spinal surgery is a huge undertaking. So having that fusion at C4, C5 is going to change the way that your neck is moving in that area, okay? If you are interested, of course, as a chiropractor, I would recommend going in to see a chiropractor, because then we could help assess if chiropractic could help you, okay? Again, hypothetically, because I cannot diagnose anything through a Zoom chat, okay? Even though that segment is fused C4, C5, you still want the areas around it to be moving as well as they can. You still want all the other areas aligned and moving as well as they can be, which would help with the stiff neck and things like that. I'm sure the physio gave you stretches and movements to do for the neck, which it seems like aren't necessarily helping. Burning effect on the right fingers and right palm. Considering what's going on, that's likely coming from the neck. There are different areas as well that nerves can become entrapped, put pressure on and things like that can cause similar things. But if you had issues that led to the cervical fusion, like I said, it's likely that it is coming from that area. Again, I cannot give you more specific information without doing a more detailed exam and having a more detailed conversation with you. But to answer your question, is this normal? No, that is most definitely not normal. And I'm very sorry that you're going through that. Is taking collagen or supplements on collagen good for degenerative disc? I'm having between L4 and S1. All right. So yes, okay. Collagen, there are like glucosamine and other things are, other things. There's another supplement if it comes, chondroitin, there we go, glucosamine and chondroitin, okay? They are good for supporting joint health and disc health, okay? Now on that, it is always better to have a whole food source of something than to have like a synthetic or processed source of something. And so what I mean by that, so yes, we do want collagen in our body because we use collagen for a lot of things. but it is going to be more useful for your body. Your body is going to be able to use it better if we're getting it from a natural source. Okay, so bone broths and things like that, where the bones and things like that have been boiling for a long time, it's going to kind of break down those joints, get a lot of collagen in there. That's a really good source of collagen. If you don't have time to make your own bone broth and things like that, there are different bone broth powders and things like that that you can work into your diet. If you are going to take a supplement, look for, like I said, a whole food, minimally processed supplement. Okay, whether that's collagen or whether that's other things that's going to help. Okay, now for degenerative disc, previously the research was showing that once the degeneration happened, we're not going to be able to reverse that. Newer research is showing that there may be some ability to regenerate to a certain point. It depends on how old and how severe, how soon you got treatment after it happened, things like that. Like I said, that research is still kind of coming out. So it's not necessarily going to reverse, let's see, something like this to this, okay? But it is going to support it. It is going to help keep it as healthy as possible. It's going to help keep the other discs and things like that as healthy as possible. So that's a good thing as well. All right, sleep equals no movement. Okay. So yes and no. Okay, so our muscles and things like that may not be moving, but other things in our body are moving, right? So we're still breathing. Sleep is when our body's healing itself, resting, things like that. And that's a lot of times, right? People come in and they're like, oh, I think I just slept wrongly. And that's usually not the case. It's usually what we did beforehand. And then when we were sleeping and not moving the muscles, that led to, right, either that stiff neck or hip or something like that. The other night I ended up had a staycation, sleeping on a very firm mattress at this hotel. Got a lot of pain and discomfort in my hips because it's just very, very firm mattress. So when we are sleeping, we want to support our body, right? Because of the minimal muscle and overall body movement during that time. And so if you sleep on your back, okay, what we want just in general when we're sleeping is to keep the spine as neutral as possible. So when we're sleeping on our back, there's not a ton of space between our neck and the bed. So you just need potentially a flat pillow, maybe a rolled up towel. If you're comfortable with no pillow at all, that's okay too. Okay. If you are like me and you are a side sleeper, okay, then now we have our shoulder between our neck and our bed. Okay, so we have more space. So we want potentially a thicker pillow. What I personally use, which works for me, may or may not work for you, is I have the contour pillow. So my head kind of lays in the valley and then the contour comes up and supports my neck. Okay, I find it very comfortable, but that's me. Different pillows are going to feel different for different people. Okay, and then you want your shoulder either a little bit forward or a little bit back, so you're not sleeping at a 90-degree angle directly on your shoulder. Okay, to help support your hips and pelvis, you want a bolster or a pillow, right, kind of between your knees and things like that. So that's going to help elevate the leg a little bit. It's going to take stress off the hip. It's going to help take stress off the knee. So that's going to help support your body, help support those muscles while you're sleeping. Okay. My husband always placed his wallet behind his pants. Does that affect him? If he is sitting on it, yes. And that's one of the things that I have a couple of friends and a couple of patients as well that I see that and it's like, please stop doing that immediately. Okay. So yes, if you are sitting on your wallet, that will lead, because I've seen this in multiple people, okay, it will lead to a pelvic imbalance, right? Pelvic tilting and things like that over time, okay, and can lead to pain and things like that. I have seen that happen. So yes, please ask your husband to stop that, either take the wallet out when he sits down, things like that, or just find a different way to carry what he needs to. Okay, any specific food or supplements for our bones? You're very welcome, Claudia. Okay. Oh goodness gracious. This is another rabbit hole that I could go down for a long, long time. And I'll go briefly, and then Matt, if you want to have a more specific conversation, we can talk about it another time as well. Anybody else, right, can come in and talk about things. Okay. Like I said, you are very welcome. And if any of you need to leave at any time, please feel free. We are over time. Oh, that's a great question, Alan. Let me just hit this real quick. I'll come back to that. Okay, so in general, right, like for bones, a lot of people say, oh, I'm taking calcium, I'm taking calcium. That's fantastic. Your body does need calcium. Okay. Again, would be better from bioavailable sources. So your green leafy vegetables have amazing amounts of calcium. Okay. Which is going to be easier for you than a synthetic man-made supplement. So yes, calcium is necessary, but you also need other trace minerals. You need magnesium, you need phosphorus, you need zinc, you need copper. Okay. So if, like I said, we can go down the rabbit hole. You can do some research by yourself to find foods that are rich in these things and work on incorporating them. If you have a crazy busy schedule and you're like, I don't have enough time to think about that on a detailed level, then of course, by all means, please get yourself a supplement. Okay. But again, find a good quality supplement from whole food sources. I was going to say one that I use right now that helps with a lot of those. It's actually a beef liver. It's like desiccated, dried up beef liver into a pill as well, because the liver is where we store our fat soluble vitamins, vitamin A, D. Sorry, I'm just totally blanking on my fat soluble vitamins. I wasn't planning on going down this road. It holds on to those, hold on to a lot of other good nutrition and things like that as well. So that's a good way to kind of get all of those kind of at the same time in that. But like I said, there's lots of different things that you need, and I'm happy to discuss that with anyone at any time. You just let me know. All right, Alan. So we do a webinar. See you tomorrow, Matt. Okay. Thank you, Donald, as well. So we do a webinar every month. It's on different topics kind of related to the newsletters that we send out throughout the month. So if you're not signed up for our newsletter, that's a reason to go to our website and get signed up for that. That way we give you like little chunks of information throughout the month, and then we kind of tie it all together in a webinar. Oh, see, and they're saying that as well, the last Tuesday of the month. Okay. It's usually given by Dr. Tim, but he is out of town. And so that's why I volunteered to give this today. I was happy to help you guys, give you some information and things like that. And then also he and I have been discussing some other different webinar series and things like that. So if there are specific topics that you want to learn more about that aren't already on our YouTube channel and things like that, please feel free to reach out to us, like email, so that Dr. Tim email and things like that. We are happy to compile information for you guys. We want you to learn more. We want you to have access to that information. Okay, we are a little bit over time. Any last questions before we all go? All right, looks like some people have already left as well. So for those of you who are still here, again, thank you. I do really value your time. I appreciate you letting me share this information with you. You are very welcome. I really, like I said, I'm very passionate about what I do. I like sharing, I like talking, as you guys can see. Okay, so you guys have a wonderful rest of your evening. Any questions, please reach out to us. And then if you do come in and see us or send someone our way, just let them know. I'd be happy to see you, see them. Okay, have a wonderful rest of your night.
Okay, night night. Thank you.
You're welcome.